8 warning signs of poor blood circulation. Your feet have been cold for years, and you have probably decided that is simply your circulation or maybe just old age. Here is what almost nobody tells you. By the time cold feet become noticeable, blood flow may have already been quietly slowing down somewhere else in the body for months, without a single ache to warn you. And cold feet, as strange as it sounds, might be the least important sign on this entire list. Before we go further, a quick note. This video is for general educational purposes only. It is not intended to diagnose any condition, replace medical advice, or suggest a specific treatment. If anything in this video sounds familiar to you or someone you love, the most helpful next step is always a conversation with a qualified healthcare professional. Circulation is something most of us never think about until it starts to fail quietly in the background. Blood is not just a red liquid moving through your body. It is the delivery system for oxygen, nutrients, and even temperature regulation, reaching every organ, every muscle, and every nerve ending you have. When that delivery system slows down, even slightly, the effects can show up in places you would never expect, including your skin, your memory, and even the way your wounds heal. One of the signs on this list is so easy to overlook that most people blame it on something completely unrelated, and we will get to that one a little later in this video. And if you have ever forgotten a name mid-conversation and simply assumed it was old age catching up with you, stay with us until the end, because that sign belongs on this list too, and it surprises almost everyone who hears the reason why. Stick around because by the end of this video you may find yourself looking at your own body or a parent's or a spouse's a little differently. Poor circulation rarely announces itself with a single dramatic moment. It builds slowly, almost politely, hiding inside things you already do every day: a slightly colder foot, a shoe that fits a little differently by evening, a cut that just seems to be taking its time. None of these things on their own would make anyone stop and think about their blood vessels. That is exactly why so many people go years without recognizing the pattern happening right in front of them. Let's start with the sign most people already associate with circulation, before we move into signs that might genuinely surprise you. Number 1, cold hands and feet that do not warm up easily. Everyone gets cold hands once in a while, especially in winter or after stepping out of a warm shower into a cool room. That is normal. What may be worth paying closer attention to is when your hands or feet stay cold for long stretches of time, even in a warm environment, or when one side of the body consistently feels colder than the other. This pattern can be associated with reduced blood flow reaching the smaller vessels in the extremities, since fingers and toes are the farthest points from the heart and are often the first areas to be affected when circulation slows down. Margaret, a 71-year-old retired schoolteacher from Ohio, described it this way to her doctor. She said her feet felt cold inside her socks even in July, and that her husband could always tell which of her hands was colder just by holding it. It turned out to be a small piece of a much larger puzzle, one that her doctor was able to help her manage once it was identified early. Stories like this are common, not because they are rare medical mysteries, but because the sign itself is so easy to write off as simply having naturally cold hands. The reason this matters is that persistent coldness in the extremities, especially when paired with other signs on this list, may be associated with underlying circulatory issues rather than just a personal trait. It may be helpful to mention this pattern to a healthcare professional, particularly if it has developed gradually or worsened over time, rather than something that has always been true for you since childhood. It also helps to pay attention to timing. Cold hands that show up only during a walk outside in January are very different from cold feet that persist for hours after climbing into bed under warm blankets. The second pattern, especially when it becomes a nightly occurrence, tends to be the one worth tracking. Some people find it useful to keep a simple mental note or even a written note of when the coldness happens, how long it lasts, and whether warming the area with a blanket or warm water actually helps. That kind of detail can be surprisingly useful information for a doctor trying to understand the full picture. Number 2, numbness or tingling that comes and goes. There is a particular kind of numbness that is different from your foot falling asleep after sitting cross-legged for too long. That familiar pins and needles sensation usually fades within a minute or two once you move around. The type of numbness worth paying attention to is one that shows up without an obvious cause, lingers longer than expected, or returns frequently in the same area, such as the feet, lower legs, or fingertips. This sensation may be associated with nerves not receiving a steady supply of oxygen-rich blood, since nerve tissue is particularly sensitive to even small reductions in blood flow. Some people describe it as a buzzing feeling, others describe it as a kind of numb heaviness, almost like wearing an invisible glove or sock that dulls sensations slightly. Robert, a 64-year-old truck driver from Texas, mentioned to his physician that his feet would go numb about 20 minutes into every long drive, regardless of how he adjusted his seat or his posture. He assumed it was simply from sitting still for hours at a time. While posture certainly plays a role in many cases, his doctor recommended a closer look, since recurring numbness that follows a consistent pattern can sometimes point toward something worth monitoring rather than ignoring. If you notice numbness or tingling that seems to have no clear trigger, or that happens more frequently than it used to, it may be worth discussing with a doctor rather than assuming it will resolve on its own. It can also help to notice whether the sensation appears in a pattern, such as always in the same foot, always after a certain amount of activity, or always at a particular time of day. Some people also notice a related sensation, a kind of dull ache that sits just beneath the numbness, almost like the limb is working harder than it should to simply feel normal. None of this is meant to cause alarm on its own, but noticing a consistent pattern is often more meaningful than a single isolated episode, and it gives a doctor something concrete to investigate rather than a vague memory of one strange afternoon. Number 3, skin that looks pale, bluish, or unusually shiny. Skin color can tell a surprising amount about what is happening underneath it. When circulation slows down, the skin may not receive its usual supply of oxygen-rich blood, and this can sometimes cause visible changes. This might include a pale or almost grayish tone in the fingers or toes, a bluish tint around the nail beds or lips, or skin on the lower legs that develops an unusually smooth, tight, or shiny appearance over time. These changes often develop so gradually that the person experiencing them does not notice, while a family member or friend may point it out first. Diane, a 58-year-old grandmother from Georgia, only realized something had changed when her granddaughter asked why her legs looked so shiny, almost like they had been polished. She had not noticed the change herself, since it had happened slowly over the course of roughly a year. This particular sign may be associated with the skin adapting to a reduced blood supply, sometimes thinning the skin or reducing the amount of hair growth in the area as well. If you or someone close to you notices these kinds of visible changes, especially paired with any other signs mentioned here, it may be worth bringing up during your next checkup rather than waiting until the next scheduled physical. Lighting and comparison also matter here. Many people never truly look at their own legs and feet under bright, natural light, since socks and shoes cover them for most of the day. Taking a moment every so often to actually compare the color and texture of both legs side by side, ideally near a window during the day, can reveal subtle differences that fluorescent bathroom lighting tends to hide. If one leg looks noticeably different from the other in color, temperature, or texture, that asymmetry itself can be a meaningful detail to share with a doctor. Now here is something that tends to surprise people the most, and it involves a part of the body most of us check constantly throughout the day. Number 4, slow healing wounds, especially on the feet or lower legs. Most cuts and scrapes heal within a week or two, sometimes faster depending on the location and depth. When circulation is reduced, however, the body may struggle to deliver the oxygen and nutrients needed for proper tissue repair, and a wound that would normally close quickly can instead linger for weeks or even longer. This is one of the more serious signs on this list, not because it always indicates something severe, but because slow healing wounds, particularly on the feet, ankles, or lower legs, deserve prompt medical attention rather than a wait-and-see approach. Small blisters, cuts from ill-fitting shoes, or even minor scrapes from gardening can become a much bigger concern if they refuse to close properly. Frank, a 69-year-old retired mechanic from Pennsylvania, first noticed a small cut on his ankle that he assumed would heal within days, the same way it always had in the past. 3 weeks later, it looked almost exactly the same. His daughter encouraged him to see a doctor, and that visit ended up being an important turning point in understanding what his body had been trying to tell him for months. If you notice a wound on your lower body that is not improving within roughly 2 weeks, it may be helpful to have it evaluated by a healthcare professional. since early attention in these situations often makes a meaningful difference. It is also worth mentioning that slow healing is not just about the wound staying open. Sometimes the surrounding skin stays discolored long after the wound itself has technically closed, or the area remains tender and sensitive to the touch for weeks longer than expected. Keeping a simple photograph on your phone, taken every few days, can be a genuinely useful way to track whether a wound is truly improving or simply appears stable from one glance to the next. Small visual records like this often make conversations with a doctor much more precise. Number 5. Leg pain or cramping that appears during walking and fades with rest. This particular sign has a name in medical settings, something called intermittent claudication, which simply means muscle pain that appears during activity and eases once you stop moving. In plain terms, it often feels like a cramping, aching, or tired heaviness in the calves, thighs, or hips that shows up consistently after walking a certain distance, then fades within a few minutes of resting. This pattern may be associated with the leg muscles not receiving enough oxygen-rich blood during physical activity, since muscles require significantly more blood flow when they are working compared to when they are at rest. What makes this sign particularly easy to overlook is that people often assume it is simply a normal part of aging or being out of shape, rather than something connected to circulation. Harold, a 73-year-old retired postal worker from Arizona, mentioned that he had to stop and rest every 2 blocks on his daily walk, blaming it on his knees at first. It was not until he described the specific cramping sensation in his calves, and how quickly it faded once he sat down, that his doctor recognized the pattern for what it likely was. If you find yourself needing to pause frequently during walks because of leg discomfort that consistently improves with rest, this may be worth mentioning at your next appointment, especially if the distance you can walk comfortably has been gradually shrinking over time. One detail that can help a doctor considerably is noticing exactly how far you can walk before the discomfort begins, and whether that distance has changed over the past several months. A person who used to walk a full mile without any trouble, but now feels cramping after only 2 or 3 blocks, has a very specific and useful piece of information to share, far more useful than simply saying legs feel tired sometimes. Tracking distance, incline, and recovery time, even loosely, can turn a vague complaint into a clear and actionable pattern. We are just past the halfway point, and the next sign is one that many people notice on their own body but never think to associate with blood flow at all. Number 6. Hair loss or thinning on the legs and feet. This might be one of the most overlooked signs on this entire list. Hair on the lower legs and the tops of the feet relies on a steady blood supply to keep growing normally, and when circulation to that area decreases, hair growth can slow down or stop entirely over time. Many people notice this change only after someone else points it out, since it happens gradually rather than all at once. Unlike hair thinning on the scalp, which is often connected to genetics or hormones, hair loss specifically on the lower legs, especially when paired with skin that looks smoother or shinier than before, may be associated with reduced blood flow reaching that particular area. This is not something most people think to check, since it is easy to assume that hair naturally thins out everywhere as a person gets older. Carol, a 66-year-old from North Carolina, said she genuinely could not remember the last time she had shaved her shins, assuming she had simply stopped growing much leg hair as she aged. When her doctor asked about it directly during a routine visit, she realized she had not thought about it in years, and that realization became a helpful clue in a broader conversation about her circulatory health. If you notice this kind of change, particularly alongside any of the earlier signs mentioned, it may be worth bringing up in conversation with your doctor, even if it seems like a small or insignificant detail. It is worth noting that hair loss on its own, without any other signs, is very often just a normal part of aging and hormonal change, and by itself it rarely points to anything concerning. What makes it worth mentioning here is how frequently it shows up quietly alongside several of the other signs on this list, almost like a supporting clue rather than a headline. Doctors piecing together a circulatory picture often find this detail more telling than patients expect, precisely because it is so rarely brought up voluntarily during a routine visit. Number 7. Swelling in the legs, ankles, or feet, especially by the end of the day. Mild swelling after a long day on your feet is common, and usually nothing to worry about. What may be worth paying closer attention to is swelling that happens consistently, seems to worsen throughout the day, or leaves an indentation in the skin after you press on it, something doctors sometimes refer to as pitting. This kind of swelling, known as edema, may be associated with blood or fluid not moving efficiently back toward the heart, causing it to pool in the lower parts of the body instead. Gravity naturally makes the legs and feet more vulnerable to this kind of pooling, especially for people who sit or stand for long periods without much movement in between. Evelyn, a 70-year-old retired librarian from Michigan, noticed that her favorite pair of shoes had started feeling tight by early evening, even though they fit perfectly every morning. She initially assumed her feet were simply changing shape with age, something many people her age accept without question. Her doctor explained that consistent evening swelling was worth monitoring and encouraged her to track when it happened and how severe it seemed from day to day. If your shoes, socks, or rings feel noticeably tighter by the end of the day on a regular basis, it may be worth mentioning this pattern to a healthcare provider, along with any other signs from this list that may sound familiar. A simple way many people track this without overcomplicating things is by noting the time of day when tightness first becomes noticeable, and whether elevating the legs for a period in the evening seems to reduce it. Swelling that improves significantly once the legs are propped up on a pillow tends to behave differently from swelling that stays constant regardless of position, and that distinction alone can be a genuinely useful piece of information during a medical appointment. We have saved one of the more surprising signs for last, mainly because it involves an organ most people never associate with circulation at all. Number 8. Brain fog, memory lapses, or difficulty concentrating. This final sign tends to surprise people the most, simply because the brain does not seem like an obvious place to look when thinking about blood flow in the legs or feet. The brain, however, depends on a remarkably steady and generous supply of oxygen-rich blood to function properly, using a significant portion of the body's total blood flow despite being a relatively small organ. When circulation throughout the body is reduced, this may also affect blood flow to the brain, and some people report subtle changes such as difficulty concentrating, forgetting familiar names or words more often than usual, or feeling mentally slower than they used to, especially later in the day. It is important to note that these symptoms have many possible causes, and this sign alone does not necessarily point toward a circulatory issue. It becomes more noteworthy when it appears alongside several of the other signs discussed in this video. James, a 75-year-old retired accountant from Florida, mentioned to his family that he had started losing his train of thought during conversations, something that felt entirely unlike him after decades of working with detailed financial records. His family encouraged him to mention it at his next checkup, where his doctor considered it as one piece of a larger picture, alongside several other signs that had gone unnoticed for months. If you or someone close to you has noticed subtle changes in focus or memory, particularly alongside physical signs like the ones described earlier in this video, it may be worth discussing this with a healthcare professional rather than assuming it is simply a normal part of getting older. This sign carries an important caution, perhaps more than any other on this list. Memory and concentration can shift for countless reasons, including sleep quality, stress, medication changes, mood, and many conditions that have nothing to do with circulation whatsoever. The point of including it here is not to suggest that every forgotten name or misplaced set of keys points toward a circulatory problem. Rather, it is a reminder that the body is deeply interconnected, and that a full picture, built from several signs rather than one alone, tends to give doctors and patients far more clarity than focusing on any single symptom in isolation. Circulation touches nearly every part of the body, from the tips of your fingers to the clarity of your thinking, and that is exactly why these signs can be so easy to miss when they appear one at a time. Out of everything covered today, one detail is worth remembering above all else. Research has consistently shown that reduced blood flow in the legs, the kind linked to conditions like peripheral artery disease, affects an estimated 6.5% of adults over the age of 40 in the United States, and many of them go undiagnosed simply because the early signs seemed too minor to mention. That statistic matters because it means millions of people are walking around with a quiet, treatable issue that simply has not been named yet. None of these signs, taken alone, are cause for alarm. Taken together, they may be worth a conversation with your doctor, especially if you recognized more than one of them while watching this video. Think back for a moment to Margaret with her cold feet in July, Robert with his numb legs on long drives, Diane with her shiny shins, Frank with his slow healing ankle, Harold pausing every 2 blocks. Carol who could not remember her last shave, Evelyn with her tightening shoes, and James losing his train of thought mid-conversation. Each of them noticed something small. None of them connected it to circulation on their own. That is the quiet thread running through this entire video, and it is worth carrying with you long after it ends. So here is a question worth sitting with. Which of these 8 signs surprised you the most, and did any of them remind you of something you or a loved one has experienced? Share your thoughts in the comments below, since these conversations often help someone else recognize a pattern in their own life that they had not connected before. If this video gave you something valuable to think about, consider sharing it with someone who might need to hear it today. Whether that is a parent, a grandparent, or simply a friend who has mentioned cold feet one too many times. And if you would like to see more videos like this one, breaking down the body's quiet signals in a way that actually makes sense, consider subscribing so you do not miss what comes next.